Chapter 28, Musculoskeletal Trauma. Angulated fracture is a fracture in which the broken bone segments are at an angle to each other. Bones are hard but flexible living structures that provide support for the body and protection of the vital organs. Cartilage is tough tissue that covers the joint ends of the bones and helps to form certain body parts such as an ear. Closed extremity injury is an injury to an extremity with no associated opening in the skin. Comminuted fracture is a fracture in which the bones is broken in several places. Compartment syndrome is injury caused when the tissue, such as blood vessels and nerves, are constricted within a space, as from swelling or a tight dressing. Crepitus is a grating sensation or sound made when fractured bones rub against one another. A dislocation is the disruption or coming apart of a joint. Extremities, the portion of the skeleton that includes clavicles, scapula, arms, wrists, hands, pelvis, thighs, legs, ankles, and feet. A fracture is any break in a bone. A green stick fracture is an incomplete fracture. Joints is places where the bones articulate or meet. Ligaments are tissues that connect bone to bone. Manual traction is the process of applying tension to straighten and realign a fractured limb before splinting. Muscles are tissues or fibers that cause movement of the body parts and organs. Open extremity injury is an extremity injury in which the skin has been broken or torn through from the inside and is injured bone or from the outside. A sprain is the stretching and tearing of a ligament. A strain is muscle injuries resulting from overstretching or overexertion of a muscle. Tendons are tissues that connect muscle to bone. A traction splint is a splint that applies constant pull along the length of the lower extremity to help stabilize the fracture bone to reduce muscle spasms.